Has anyone come to you and said, we want a smile like Shah Rukh Khan?
There was a lady who told me that I want a smile like Madhuri.
Wow. This word is trending a lot, the celebrity look.
Aesthetic is there, but it affects your positivity. Alia Bhatt. Or one of the tooth is, jutting out. It looks very cute on her.
As a smile designer expert, what's your go-to treatment to make their smile better?
For veneers. It just changes your personality completely.
I don't see braces anymore.
Invisalign, it is booming in India as well.
So what is the correct way of brushing the teeth?
If you brush horizontal, you're going to damage your teeth very fast.
What is the first thing that I should do to have a better smile?
And you will genuinely give authentic smile rather than giving a fake smile.
Before introducing our today's guest and even myself, I want to start this podcast by narrating a beautiful poem which is written by Nayab Midha. And it says, smile if you have lost something. Maybe it was destined to be theirs. Smile if you are feeling hopeless. Thinking over and over, maybe this could have been better or that could have been better. Smile if your heart is broken. Because sometimes to fix one heart, another has to break. And if you still feel pain in the heart, just talk and smile. Smile if you have roof over your head. Smile if you have clothes on your body. Smile if you have food on your plate. And if you have more than what you need, just share and smile. Even if you want to walk miles and miles, just smile. And it's okay to have half empty glass, because at the end of the day, you'll always fill it with smiles. Hello everyone, a very warm welcome to all the people who are watching this podcast. My name is Akshay, and the reason I talked about smile before is we as human beings, we do not acknowledge the importance of smile in today's world especially. But that being said, there are a lot of people who want to smile openly, but they struggle with their insecurities which hold them back. Issues like a gummy smile, issues like yellow stain on their teeth, issues like teeth alignment problems. They often break people's confidence and it prevents them to smile openly. So today, we will be discussing with our guest, whose name is Dr. Umang Shah, who is a smile designer by profession, and he has almost 9 years of experience in this field. And today, we will ask him all the questions that how can we improve our smile, what are the treatments that we can consider to improve our smile, and without further ado, let's start this podcast. So Dr. Umang Shah, a very warm welcome. Really appreciate your time and presence. First of all, how are you feeling?
Thank you for inviting. It's honor and privilege to be here on your channel, on your podcast. Yeah, I'm very much excited to share my experience and my knowledge when it comes to smile.
Great. So tell me, what is the first thing that you notice in a smile that makes you think, wow, that's a great smile?
See, a smile is, a universal gesture, right? I don't know if you have come across an image which, there's a family of parents with a kid where one of the father has a missing tooth, front tooth. And when we actually see, we notice, the one thing that we notice is the teeth. But when we look closer, he has a missing eyebrow. Okay, so we don't notice the eyebrow, we notice the teeth. Okay, so the smile is so important that when you meet someone, smile is the thing that, we notice first. So yes, it is so important to get a perfect smile so that you attract a lot of people. And, this is how actually your well-being is, right? If you have a good smile, this is how your flow is actually towards your life.
How should someone smile? What I mean is there something, is there any trick or some hack that just works anywhere? Means if I'm in a party, or let's say if I'm in an event, or let's say if I'm facing a camera, how should I smile or someone smile?
See, there is no hack as such, but have you heard of something called as Duchenne smile?
No.
Okay, so he's a French person, where he claims that whenever you smile, there should be a crinkle near your eyes.
Okay.
So there should be, your eyes and your mouth should coordinate in such a way that your smile should be. So in that way, your smile is more authentic, more joyful, and that warmth and passionate that comes through your smile is more attractive to the opposite person. Okay, so whenever you smile or you laugh, it should always go with the coordination with your eyes and your mouth. Okay, and if you're very much conscious enough, just smile in such a way that the corner of the mouth are elevated, and just gives a pleasing warmth appearance to the opposite person.
This question is super exciting, okay, and I want you to be very honest, okay, since you are a smile design pro. When you see my grin, right, what's your pro eye telling me you need to fix this one? And before you answer, to the people who don't know what grin is, and you can correct me if I'm wrong, grin is basically showing off your teeth when you smile, right? Is it correct?
Right, true.
So what should I improve?
See, to be honest, you've got a good smile.
Thank you.
There's nothing to be improved on, where it comes to alignment or the shade, or getting your gums aligned or reshaping your gums. It's perfectly matching with your lip length and your face and your facial architecture. But yeah, this is it, because everyone has got a unique smile, right? Not necessary that all individual needs corrections. Like, I have to give you an example of Alia Bhatt. Her one of the tooth is jutting out, but it looks very cute on her.
Right.
So not necessary, like, it requires changes all the time. If it suits your face, your profile, it's absolutely fine. So it does. You got a good smile.
Thank you so much. Since this conversation is happening around smile, right? You are known for smile redesign, right? So tell me, and to the people, in a very layman's language, what is smile reconstruction, or you can say smile redesign?
See, now, though both the things are different, smile redesigning or smile reconstruction and smile makeover is completely different.
Okay.
When we talk about smile reconstruction or redesigning, not only aesthetics or looks is concerned, also the function is concerned in that case. So if you have to redesign that thing, orthodontic treatment, alignment, veneers, implants, crown bridges, a lot of things are into getting a redesign so that you get a perfect smile, gums recontouring. When it comes to just smile makeover, only your aesthetic is being looked into besides your function. So with the help of just teeth whitening, or with the help of veneers, or just slight modification of your tooth anatomy will also make a lot of difference if you go for smile makeovers. So it varies from person to person whether they require smile recontouring or smile makeover.
You mentioned the word tooth whitening, right?
Yeah.
So what exactly it is, and how much does it really matter?
See, to be honest, it does matter, and this generation teeth whitening is booming. Like every individual are looking to get their teeth whitened now and then. To be honest, like, if you have your teeth aligned, if it is good proportion and in good alignment, teeth whitening won't matter as such. Okay. But if it is not aligned, and if you want to get the teeth whitening, it won't make that much difference.
Tell me, as a smile designer expert, right, what's your go-to treatment or the first move that you do for your patients to make their smile better? Like you have said, do you apply veneers, or do you give treatment of tooth whitening? What do you give?
See, now, obviously, there's no such a fixed treatment or a fixed step for every individual. It varies from person to person, as I mentioned earlier. But yes, I would always lean towards veneer. Why? Because it has got a lot of advantages. It's a long-term solution, and it can almost solve all sorts of problems. Okay, but there are also limitations to veneers. Okay, so if there is a lot of crowding and it needs correction, there's no other option as to go for alignment, right? But if there is slight gaps or slight crowding, it can get corrected with the help of veneers. Even stains also get corrected with the help of veneers. So I would obviously lean towards veneers.
Venus, it's a very interesting word. I often hear that every other day, right? So what it is actually in science terms, please explain us. And also, why do they make our tooth very attractive?
It's a thin layer of shell of a porcelain or a resin which has been applied on the front surface of a tooth.
Okay, front surface means
Only
this.
on the front surface. Okay, so it's like a fashionable outfit that is worn on your tooth, which will make you look more natural.
Great.
Okay, it closes all your gaps. It removes all your stains. If you are heavy coffee, tea, or red wine drinker, this is the best line of treatment. It is customizable. If you want some kind of shade, it can be made.
Okay.
Okay, it is less invasive. Like minimum amount of tooth structure needs to be altered. And it is faster line of treatment. It can be done in couple of visits.
Okay.
And all individual who are in front of camera are mostly they usually go ahead with this kind of treatment. Why? Because it gives a more natural and pleasing appearance to them.
Okay.
And it's a beautiful a mode of changing your smile. It just changes your personality completely.
Great. So can we refer these two as false nails?
Kind of.
Do you have any story in your mind that you gave a treatment to your patient which changed his life completely? Do you have any story?
Oh yes, I cannot forget those. I'll just mention two individuals. One is young and one is he's aged.
Great. We would love to hear.
So
on both of them.
one lady, like, she was very shy and very conscious, and she had visited many dentists, but somehow she was not happy, or she didn't get the treatment done in XYZ. So she came to our office clinic, and we did her complete analysis, her facial expression and her smile line and everything. Then we delivered the veneers according to her smile. And trust me, she started crying on the chair.
Wow.
Like, I gave her the mirror and she just started crying. That was a moment I still get the goosebumps, looking at her. The changes that she got through the transformation, forget that. Once she went back, everyone was shocked whether, seeing her, whether she's the same individual or no. Her professional life increased. She's still in contact with me, and she keeps texting me, ki how you have changed my life. Her career has grown to a next level. The positivity that comes
Right.
from her from within is completely changed. That is one example. See, I'm still having the goosebumps.
Great.
The other one is when I just told you regarding the old age.
Yeah.
He had many missing teeth, unable to eat, and health issues and this and that. So her daughter got him to my clinic. I don't know where they came to know, but touch wood, they came to my clinic and got the treatment done. He was around 89, 90 years.
Okay.
And post that, his health just increased.
Wow.
Because that function that we led or just gave them through the teeth, he was able to eat way too much, and his weight increased, his health increased. They've given such a huge big review on our Google.
Okay.
So it really makes me happy to deliver such kind of smile and function to such kind of patients.
This is my personal observation. I have a lot of friends, and I don't see the usage of braces anymore. I don't know why. Has something changed? I don't know, but people are using this new, you can say, equipment, if I'm not using the right word, but which is also called Invisalign, right?
Right.
So what's your take on that?
See, obviously, the generation has completely changed. Earlier, there were only metal braces or ceramic braces, and
Right.
there were different kind of brackets that were attached to your tooth. but there were a lot of flaws or a lot of difficulties to the patients where they faced, like the wire is pricking, they're unable to eat, there's difficulty in speaking, there are ulcers in their mouth.
Right.
But in say around 20 years back, in 1997 if I'm not wrong, Invisalign had they had actually founded or launched at that time.
Okay.
But with time, it has come all over the world and spread all over the world, and now it is booming in India as well. Yes, I'm grateful that few of the brands, like which are endorsed with some celebrities, have created a lot of awareness.
Right.
So yes, Invisalign is the option to get our teeth aligned. Why? Because it is easy to maintain your teeth. Okay, you can. There's no restriction in eating any kind of food.
Mhm.
It is invisible. People won't come to know that any kind of treatment is going on.
Okay.
Okay, and it is convenient. It is faster. So always, this generation wants that convenience and faster mode of treatment. So that is why the traditional method is slightly being taken aside, and then Invisalign is overtaking them. But yes, to be honest, not all cases can be done through aligners. When it comes to complex cases, traditional are the
So is there
options.
any age limit, or you can say age range, that we can have this Invisaligns?
No, to be honest, there is no age limit as
Okay.
such, because tooth movement does happen in all kind of ages. When it comes to the age factor, your tooth movement can happen at any age.
Okay.
Okay. But if you want to get a better facial structure and everything, it is always better to get your alignment done at the growth spot, whether it is girl or a boy. So at the age of say around 11 to 14, if you get the
Okay.
teeth aligned, that is the best time to get that aligned for the long-term stability of your tooth and
Okay.
a good aesthetics.
Okay.
Okay, so age factor is not really a matter.
So this is a very curious question. Okay, has anyone come to you, like client or you can say patient, come to you and said, we want a smile like Hrithik Roshan, or you can say Shah Rukh Khan? Has this happened to you?
I would not say Hrithik or Shah Rukh, but yes, there was a lady who told me that I want to smile like Madhuri.
Wow.
It was a pretty the conversation was very interesting when it came to such kind of statement, like I want a smile of Madhuri Dixit, but I need to know what their a goal is,
Okay.
like every individual has got a different smile, right?
Great.
So when it comes to, for an example, if someone wants a smile like Hrithik,
Right.
he's got a elongated teeth,
Mm-hmm.
he's got bright teeth, he's got good alignment. So what factors are you looking at?
Hmm.
So we can produce that kind of smile to them. Like not necessarily his teeth length or alignment or smile will match that person. So it all depends on the facial structure and tonicity and everything.
Okay. The reason I asked you this question is because, see, we as human beings, we always compare ourselves to others, right? And in way or some other way, we always want to look like someone else.
Right.
And especially this word is trending a lot, the celebrity look, right? But how important it is for us as clients or patients to tell professionals like you that please give us the treatment that will look good on my face. So how important it is?
See, it is very important to get your smile as per your facial structure.
Okay.
Forget aesthetic is there, that is there, but it affects your positivity.
Mhm.
Okay, it increases your self-consciousness. It just boosts your confidence. As I told you earlier, that patient of mine, it has helped her professionally so much. Her career has gone to a next level. You tend to attract more people.
Hmm.
Okay, there was a client like she used to not get married because of her teeth alignment, or she had unfortunately not that pleasing smile. But post treatment, she got attracted, and now she's happily married.
Okay.
So smile is equally important besides all those makeup and all those kind of other makeovers. Smile is equally important.
And how much does this smile design cost? Means, what's the cost structure?
See, it varies from few thousands and it also goes up to lakhs. It depends on the complexity of the cases.
Okay.
But we can always fit into your kind of mug which is there. If you get a good honest budget that you have in your head, then we can always give you that kind of treatment modalities or options that even you are comfortable, and I can give you a good desired line of treatment in your budget.
There is a category of people who say when you take oral treatment, you can damage your teeth, right? First of all, is it a myth? If yes, then please explain.
See, this is a very debatable question, and I can go on speaking on this because, see, just to give you an example, if a patient is getting a work done from a quack, yeah, you know what is a quack, right?
Right.
So just for the explaining, quack is a person who is not qualified and just doing XYZ treatment on a patient. Okay. So if a patient does a treatment from a quack and they just do some kind of treatment and then they come back to us, to a professional dentist, this issue is there. I'm having this pain and please get it corrected. And then we ask them, how did this happen? And then they tell their story. And then once we start correcting, and then the pain increases. Why? Because the infection is already there. So they don't understand that the earlier person, the quack, has created an infection which has led to this and not us.
Okay.
So then they start feeling that because of the treatment I'm getting those issues. The other is if we have a missing tooth, right? The best option would be to place an implant.
Okay.
If you don't offer an implant, you go for a bridge. For a bridge, we need to do adjustment of adjacent teeth. We need to do slight grinding of your teeth.
Okay.
So according to me, obviously, if you have a healthy teeth, if you're grinding it, you tend to damaging your teeth, natural teeth. So in that cases, you are damaging, to be honest. Okay, so mode of treatment also leads to damaging of your teeth or no.
Okay.
One more example, like when it comes to braces or aligners, if the kid is not well maintained oral hygiene, and if you still go for metal braces, obviously maintenance would be difficult for him. So there are tend to decay and plaque formation and XYZ, and then you will blame that because of braces other issues have started.
Right.
At first place only you should have opted for aligners, then the issues wouldn't have started. So it's a very debatable question, but it depends what line of treatment you choose and where and from whom you get the treatment done.
I also want to ask you, it's a bit of out of context question, but we all know that smoking and consuming tobacco and also alcohol consumption damages your teeth, right? It leads to oral cancer. But we have seen that mouthwashes have a bit of alcohol percentage. So is it safe to use mouthwash? If yes, then which kind of mouthwash should we use? Alcoholic or non-alcoholic?
See, obviously, they contain some amount of alcohol and chemical in it, right? To be honest, we only prescribe when there is any gum issues or we have any surgery or implant placement. Okay. All those commercially available mouthwash contains alcohol.
Okay.
Long-term use of those mouthwash leads to dryness of mouth. Okay, and then it in turn lead to decay and XYZ. That cycle goes on.
Okay.
So we only prescribe those medicated mouthwash only when required, only for 2 weeks, not more than that. Because mouthwash also leads to your staining of your teeth.
Right.
If you didn't know. So it is not that good. Yes, you will feel that freshness, that the whiteness, you get some amount of teeth whitening effect through the mouthwash, but long term it is not good.
Can you explain us the concept of bad breath?
Okay. So scientifically it is also called as halitosis. Okay. So bad breath usually happens if you don't brush.
Okay.
twice minimum.
Okay.
You don't floss. If there is any gum infection, tooth decay, a lot of plaque and calculus which is accumulated on a tooth. So basically, if you're not well maintained oral hygiene, then you tend to get, halitosis or bad breath. So advice would be just follow up 6 months to a dentist. Get a routine checkup done. Not
Okay.
necessary, you need to get your teeth cleaning done every time. Only if it is required, the specialist will tell you. Otherwise, just get a normal routine checkup done every 6 months and you will be free of your bad breath.
I also want to talk about DIY products, right? A lot of brands are promoting, and I don't want to name any brands, okay, because it will get very controversial. But we see them all over the internet. Whenever I scroll YouTube or whenever I scroll social media, we see their ads, right? And they are targeting, if I'm not wrong, young people. Because I have seen they send you the full kit and they say you can do it yourself. So, is it safe to use?
See, there are a lot of products that are available online when it comes to, do-it-yourself kind of a thing, like teeth whitening is there, then aligners are there. And then there is something called as quick veneers, party veneers are there. Like it's just a flexible thing that you just need to wear and you are good to go. But to be honest, you need to have the assessment done before using any product.
Okay.
You need to know whether the product are safe or not, because it contains chemicals when it comes to teeth whitening. You need to know whether they are FDA approved or ADA approved, whether the products are safe to use. Because any product, if it is used in excess, is not good under any observation.
Right.
Obviously, if the teeth whitening contains hydrogen peroxide, right? So in long term, obviously, it will lead to your sensitivity. Okay, and it is not reversible.
Okay.
Once the tooth structure is lost, it's lost. And so any product which is there, it is always good to be used under some kind of observation or some guidance.
Okay.
Even when it comes to aligners, yes, there are many aligners in the market which are available at home. Just scan and you'll get the aligners at home. But who is responsible? A doctor behind those aligners. They align and then they give you.
Right.
But there's no assessment where the treatment is leading.
They are not providing any technician, right?
Exactly. They'll give you aligners through the scanner, everything technological wise. They'll do a good job. But who is assessing?
Right.
So it is always better to get it done through a specialist, through under observation basically.
Okay.
Where you are in a safe hands and things won't go haywire here and there when it comes to your teeth.
Okay. I want to ask you, people are using electric toothbrush, right? What's the difference between electric toothbrush and normal toothbrush? People are opting for them, and the feedbacks is also such that it's really good.
This generation always wants something electronic. Like
Right.
everything has got technological base, so they are more excited to use technological based instrument or a gadget or anything. So when it comes to manual or electric, I would always prefer kids to use manual toothbrush. Why? Because
Okay.
they get that coordination, hand coordination, and then that motor coordination starts building up through
Okay.
manual toothbrushing. If you directly give them electric, then they get more lazier, and then things
Right.
don't. It is good. I'm not saying electric toothbrush are bad. It is good, but this is my personal opinion that kids, if from start, if they use manual, that hand coordination increases. It is good for them and only.
Okay.
Electric toothbrush, yes, it is good, better. Say if a person is physically disabled, if they're challenging, so obviously electric toothbrush will help them brush or maintain their oral hygiene.
Right.
Okay, if not manual, at least electric is is much better.
You mentioned hand coordination, right? So what is the correct way of brushing the teeth?
Only while brushing is will not make a difference. Right technique is very important.
Right.
Okay, you should never brush horizontal. Okay, you should only brush circular or vertical. Okay, this is how you will maintain your teeth on a long go. If you brush horizontal, you're going to damage your teeth very fast. Okay, there are ditches that are formed on your teeth if you brush horizontal. Okay, and always use a medium to a soft bristle toothbrush, not too hard and not too soft. Too soft are only recommended in few cases where you've got gum issues or too much of sensitivity. But medium and soft toothbrush, a normal individual with healthy teeth are a good go.
We have talked about toothbrushes, right? Now we'll talk about toothpastes. And I don't want you to promote any brands, but what should be the chemical content that people should look for?
All kind of toothpaste have got almost similar kind of composition, right?
Okay.
Only few fillers here and there, and then the branding has been done. Okay, so yes, only when it comes to sensitivity, then obviously it does contain medicated components in it. But when it comes to kids, there should be no fluoride in the toothpaste when we have to brush our kids' teeth. When it comes to adult, yes, the fluoride content needs to be there. About more than 1,000 ppm of fluoride needs to be there. This is how the tooth are safe from your tooth decay. It forms a layer, a protective layer of your tooth, which will prevent from decay of your teeth.
It is often said that mouth is the gateway to all the diseases, right? It is also said that dentist is the only person who can detect all the diseases before. So how true is this, first of all? And what are the major diseases that a dentist can recognize before happening?
To be honest, according to my experience, all these diseases starts through your mouth, because mouth has got a lot of microflora or bacteria, and
Right.
so there are many diseases that can be diagnosed through the through your oral cavity, looking at your teeth and your tongue and your oral tissues, basically. When it comes to gastric issues, okay, your teeth are affected. So, for example, you've got a lot of acidity. Okay, so your teeth are. So it is basically your teeth just washes out, or it becomes very sensitive. Okay, that is one thing. When it comes to diabetes, your gums are swollen, it starts bleeding, your teeth starts shaking.
Right.
Okay, so diabetes also can be diagnosed. But if you have some heart issues or you are medicated related to your heart problems, dentist needs to be more cautious before starting any treatment, because it is all connected to your blood, right? So it is equally important to maintain your oral hygiene, to maintain your overall body health as well.
Is it related, your teeth and every other organs?
Yes, I'll give you my personal experience of a patient. She, from past many years, she had got ear pain.
Okay.
Ear pain, headache, neck pain, back pain.
Okay.
And it had actually gone to the lower part of her back. She had visited, say, many doctors, neurosurgeons and ENTs. I don't know, somehow she just came to our clinic, because we specialize, we are prosthodontists, right? So we specialize in the TMJ joint and your jaw pain, orofacial muscular pain.
Right.
So I diagnosed, and after taking few X-rays and few clinical tests, she had got the temporomandibular, the jaw joint issue was there. So we diagnosed, and say after a couple of months, after the treatment, all her pain slowly just vanished.
Okay.
So even that kind of diagnosis is so important to get that kind of relief. Like, if it is back pain, not only medicine will will cure that kind of pain. If you have a headache, if you have a continuous headache, there has to be some reason which is leading to it.
Right.
So thorough diagnosis needs to be done when it comes to the jaw pain, your back pain, and your headache. And yes, wisdom tooth sometimes lead to that kind of ear pain as well.
Okay. So one final question. What is the first thing that I should do from today to have a better smile? Not me, but to someone who is insecure about their smile. I know treatments are the best options, but if someone has to start from today, what he or she can do?
See, to be honest, brush twice daily, floss daily, keep your oral hygiene well. This is how you will be confident enough, and that positivity will come out, and you will genuinely give authentic smile rather than giving us a fake smile.
Fake smile.
But then if you want to actually have a good smile, do visit a dentist. Just take an assessment done from the specialist, and just know what kind of or the line of treatment you require to get a flawless smile.
Right.
So that will really help in growing yourself.
Okay. Since I have asked you all the questions, one question is remaining, that when you do such kind of treatments, what is the role of computers or especially technology? How much do they help you?
See, this is the era of AI
Right.
or artificial intelligence. So you have to be in align with the technology that is available, right? So yes, in dentistry also there is AI that is there. Like, there are digital scanners that are available, which helps us in treatment planning. Okay, it helps in patient communication also. The scanners is so convenient. We can show the images to the patient and show their teeth health directly on the screen, how they look. Okay. Remember, I don't know if you've gone to a dentist or no, but when there is any treatment required, say a crown or an implant, we need to take a manual impression to send it to the lab. Right. So after the digital scanner, there's no need to take that manual impression. We just need to send the scan to the lab, and the work is been resent in like couple of days. You don't need to wait for like weeks and weeks to get a treatment done.
Right.
Smile designing can also be done through this digital scanner.
Great.
And orthodontic treatment, teeth alignment is always there with the help of this technology, where they can help you get your teeth aligned.
So would you demonstrate?
Yeah,
it for us?
definitely. Why not? So as we discussed earlier, that AI technology and digital scanner. So this is one of the best digital scanner which is available.
Okay.
And we own it, and I'm really proud of it. Okay,
Great.
so as I told you, it really helps in communication with the patient. It is so convenient to show patient how your teeth health is. Okay, when it comes to all the surfaces of your teeth. As I told you, you've got a good set of teeth.
Right.
So this is your scan. So there's no much flaws.
This is my scan.
No much flaws that are seen. So I'm just showing you how it looks. So it just shows you your teeth health,
Right.
your gum health
Right.
on upper and lower teeth. When it comes to alignment of your teeth, how your bite is. Okay, it's a beautiful technology that they've come up with, the alignment and the overview.
Right.
Your bite on your right and your left hand side. So this is how it explains. It is easier for us to explain regarding your oral hygiene. They've got a beautiful technology where we come to know your treatment outcome before starting your treatment.
Okay.
This is how you are right now.
Okay.
And this is how your alignment would be. Slightly, there's slight changes in your case, not much, but post alignment, this is how this will look.
Okay.
And post smile designing, this is how it will look. The teeth length is increased.
Mm-hmm.
It is just matching with the lower lip, and everything is planned in such a beautiful way.
Yeah.
And this is how this technology helps in even the patient is more welcoming or accepting such kind of treatment once they see how the final outcome would be.
Right.
So this is really helping us to grow our practice and deliver good clinical treatments.
So this is basically a simulation software.
Right.
Perfect. So Dr. Umang, thank you so much for your time. Really appreciate. I think people will learn a lot from this podcast, and I'm sure it would help them in their life. Again, if someone wants to, find you, where they can find you.
See, I'm usually based in Pune near NIPM Road. So obviously we've got a website called www.thedentalethics.com. You can visit there. Obviously, there are information, contact details available there. Even if you can WhatsApp me on that number, I will revert back to you in like a day's time. So, but don't worry regarding your location, because we've got clients from Australia, USA, Dubai,
Right.
Bangalore, and cities around Pune where they've come. They've delivered the work within like couple of days or weeks, and then they're good to go.
It was pleasure talking to you, sir. Once again, thank you so much.
Thank you so much for inviting.